بسم الله الرحمن الرحيم. اتكلم عن الكاستر directed therapy for pulmonary embolism, Assiut University experience. Caster directed therapy is considered as one of the newest treatment options for pulmonary embolism. According to the ESE guidelines, caster directed therapy is now a class 2A recommendation for patients with high risk PE in whom thrombolysis is contraindicated or has failed. Caster-directed therapy of PE includes mechanical fragmentation or mechanical thrombectomy with or without thrombolytic therapy, and caster-delivered thrombolytic therapy alone. The goal of caster-directed therapy is to decrease afterload on the right ventricle and reducing clot burden and long-term sequelae of CTF. Various devices that have been utilized to treat acute pulmonary embolism زي الجرينفيلد كاستر، البيكتيل روتيشنال كاستر، الانجيوجيت بس ده بقى كونترا انديكيتد دلوقتي في البلمونري امبوليزم، الايكوس والبنمبرا والفلو درايفر ديفايس. Assiut University experience. During the period from 2018 to 2021, 50 patients were enrolled in our study to evaluate the safety and efficacy of caster-directed therapy in acute high-risk PE compared to systemic thrombolysis. This study was supervised by Dr. Amani Omar, Dr. Yusuf Ahmed, Dr. Abdelazim Abul Fadl, and Dr. Ayman Khairi. 25 patients underwent caster-directed therapy, either fragmentation by pigtail caster only or combined with local thrombolysis. Mechanical fragmentation was done using a 6 French pigtail caster inserted inside the thrombus, guided by CT images. The caster was quickly spun a rotational movement manually to fragment the central thrombus and establish initial flow into pulmonary artery. The mortality rate was 25% in caster-directed therapy group compared to 32% in systemic thrombolysis group. The pulmonary artery systolic pressure significantly decreased in the caster-directed therapy group compared to systemic thrombolysis group. Also, the improvement in blood pressure, oxygen saturation, and heart rate during the first 48 hours was significantly higher in the caster-directed therapy group. دي كيس من اللي احنا اشتغلناهم. ده كان male patient 70 years old, not known to be diabetic or hypertensive. The patient had history of fractured neck femur 1 week ago that required surgical fixation. Patient presented to the ER with acute onset dyspnea and chest pain. Clinical examination, blood pressure was 80/40, the pulse was 150 per minute, saturation was 9%, respiratory rate was 40 breaths per minute. Lab investigation, ABG on voluntary mask 40%, show marked CO2 wash and saturation was 94. Troponin was positive, otherwise other lab investigation were normal. Imaging, multi-slice CT chest with pulmonary angiography was done and revealed bilateral main pulmonary embolism. Echocardiography showed moderate dilated right side of the heart, severe tricuspid regurg with severe pulmonary hypertension. PASP was 75 millimeter mercury. Positive McConnell sign. The decision was to do urgent caster-directed fragmentation of the embolus, as the patient had high-risk pulmonary embolism and had a history of recent operation, so systemic thrombosis is an absolute contraindication. Fragmentation of PE was done using a multi-purpose 6 French pigtail caster using rotational technique to fragment the embolus. هنا القسطرة في المين pulmonary بدأ يدخل في الليفت مين. هنا بعد ما أخذنا الصبغة باين الثرومبس. بعد كده بنبتدي ندخل بالواير عشان نبتدي نعمل الروتيشنال موفمنت والفراجمنتيشن بتاع الثرومبس. ودي الروتيشنال موفمنت. The caster-directed fermentation was successful. And patient was gradually weaned from vasopressor and oxygen during the next 3 days. Blood pressure became 130/80, saturation 96 on room air, PSP decreased to 55 millimeter mercury. Patient started oral anticoagulant and was discharged after 1 week. دي برضو صورة before and after. طبعا في جزء لسه قاعد عشان هو ما اخدش local thrombolytic. في فيزل كان completely occluded بقى بين ان هو اتفتح بعد كده والفيزلز الديستال دي بقت perfused. Take home message. PE is one of the most common causes of death worldwide, making an early diagnosis and treatment help survival. Caster-directed treatment is one of the newest treatment options for PE. Consider caster-directed treatment in high-risk and intermediate high-risk PE patients who has a contraindication to systemic thrombolysis or had failed systemic thrombolysis. Thank you.